Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A client has just been placed on mechanical ventilation. Which nursing action is the highest priority? A. Check bowel sounds. B. Assess breath sounds and oxygen saturation. C. Weigh the client. D. Encourage oral fluids. Correct answer, B. Assess breath sounds and oxygen saturation. Rationale: the priority is to ensure the ventilator is providing adequate oxygenation and ventilation. Question 2. Which client is the best candidate for mechanical ventilation? A. A client with controlled hypertension. B. A client with severe respiratory failure and inability to maintain oxygenation. C. A client with mild asthma controlled by an inhaler. D. A client with a urinary tract infection. Correct answer, B. A client with severe respiratory failure and inability to maintain oxygenation. Rationale: mechanical ventilation is indicated when the client cannot maintain adequate oxygenation or ventilation. Question 3. A ventilator alarm sounds continuously. What is the nurse's first action? A. Turn off the alarm. B. Assess the client. C. Silence the alarm permanently. D. Call the respiratory therapist immediately. Correct answer, B. Assess the client. Rationale: always assess the client before troubleshooting the ventilator. Question 4. A high-pressure alarm is sounding on the ventilator. Which condition is the most likely cause? A. Client coughing. B. Ventilator tubing disconnected. C. Power failure. D. Empty humidifier. Correct answer, A. Client coughing. Rationale: high-pressure alarms commonly result from coughing, secretions, biting the tube, or airway obstruction. Question 5. A low-pressure ventilator alarm sounds. Which finding is the nurse most likely to observe? A. The endotracheal tube is disconnected. B. Thick secretions in the airway. C. The client is coughing. D. Bronchospasm. Correct answer, A. The endotracheal tube is disconnected. Rationale: low-pressure alarms usually indicate an air leak or disconnected tubing. Question 6. Which nursing intervention helps prevent ventilator-associated pneumonia, VAP? A. Keep the head of the bed flat. B. Perform oral care regularly and elevate the head of the bed 30 to 45 degrees. C. Limit suctioning. D. Turn the client once daily. Correct answer, B. Perform oral care regularly and elevate the head of the bed 30 to 45 degrees. Rationale: oral hygiene and head of bed elevation significantly reduce the risk of VAP. Question 7. A mechanically ventilated client suddenly becomes restless, and oxygen saturation drops from 98% to 84%. What should the nurse do first? A. Increase the 4 fluids. B. Assess the airway and ventilator tubing. C. Document the findings. D. Administer pain medication. Correct answer, B. Assess the airway and ventilator tubing. Rationale: sudden hypoxia may indicate airway obstruction, tube displacement, or equipment malfunction. Question 8. Which assessment finding indicates a client is ready for weaning from mechanical ventilation? A. Stable vital signs and adequate spontaneous breathing. B. Oxygen saturation of 82%. C. Continuous use of high-dose vasopressors. D. Severe respiratory distress. Correct answer, A. Stable vital signs and adequate spontaneous breathing. Rationale: clients should demonstrate stable respiratory and cardiovascular status before weaning. Question 9. The nurse is suctioning an endotracheal tube. Which action is appropriate? A. Suction continuously while inserting the catheter. B. Apply suction only while withdrawing the catheter. C. Suction for 30 seconds continuously. D. Instill normal saline before every suctioning. Correct answer, B. Apply suction only while withdrawing the catheter. Rationale: suction should be applied only during withdrawal and generally for no longer than 10 to 15 seconds. Question 10. Which finding requires immediate intervention in a mechanically ventilated client? A. Oxygen saturation of 99%. B. Bilateral breath sounds. C. Accidental extubation. D. Heart rate of 84 beats/min. Correct answer, C. Accidental extubation. Rationale: accidental extubation is a life-threatening emergency that requires immediate airway management and possible reintubation. Question 11. A mechanically ventilated client suddenly develops absent breath sounds on the right side, hypotension, and tracheal deviation to the left. What complication should the nurse suspect? A. Pulmonary edema. B. Tension pneumothorax. C. Atelectasis. D. Pleural effusion. Correct answer, B. Tension pneumothorax. Rationale: positive pressure ventilation can cause a tension pneumothorax, a life-threatening emergency characterized by unilateral absent breath sounds, hypotension, and tracheal deviation. Question 12. A nurse is caring for a mechanically ventilated client. Which finding suggests the client is not tolerating the ventilator? A. Oxygen saturation of 98%. B. Restlessness and use of accessory muscles. C. Regular respiratory pattern. D. Heart rate of 78 beats/min. Correct answer, B. Restlessness and use of accessory muscles. Rationale: agitation, accessory muscle use, and dyspnea may indicate respiratory distress or ventilator asynchrony. Question 13. Which intervention is most effective in preventing ventilator-associated pneumonia, VAP? A. Keeping the client flat. B. Elevating the head of the bed 30 to 45 degrees. C. Limiting oral care. D. Suctioning every hour regardless of need. Correct answer, B. Elevating the head of the bed 30 to 45 degrees. Rationale: elevating the head of the bed significantly reduces the risk of aspiration and VAP. Question 14. A nurse notices a low-pressure alarm on the ventilator. What should the nurse assess first? A. Whether the ventilator tubing is disconnected. B. Whether the client has thick secretions. C. Whether the client is coughing. D. Whether the humidifier needs water. Correct answer, A. Whether the ventilator tubing is disconnected. Rationale: a low-pressure alarm usually indicates a leak or disconnection in the ventilator circuit. Question 15. A mechanically ventilated client has thick secretions. Which intervention is most appropriate? A. Restrict fluids. B. Provide adequate hydration and suction as needed. C. Turn off the humidifier. D. Reduce oxygen delivery. Correct answer, B. Provide adequate hydration and suction as needed. Rationale: hydration and humidification help thin secretions, making them easier to remove. Question 16. Which assessment finding indicates that suctioning is needed? A. Clear breath sounds. B. Oxygen saturation of 99%. C. Visible secretions and coarse crackles. D. Heart rate of 72 beats/min. Correct answer, C. Visible secretions and coarse crackles. Rationale: secretions, coarse breath sounds, and decreased oxygenation indicate the need for suctioning. Question 17. A nurse is preparing to suction an endotracheal tube. How long should each suction pass last? A. 5 to 10 seconds. B. 10 to 15 seconds. C. 30 seconds. D. 1 minute. Correct answer, B. 10 to 15 seconds. Rationale: suctioning should be limited to no more than 10 to 15 seconds to minimize hypoxia. Question 18. A mechanically ventilated client suddenly becomes anxious, tachycardic, and has an oxygen saturation of 84%. What is the nurse's priority action? A. Increase 4 fluids. B. Assess the airway and ventilator connections. C. Document the findings. D. Administer a sedative. Correct answer, B. Assess the airway and ventilator connections. Rationale: the nurse should first determine whether there is an airway obstruction, tube displacement, or ventilator malfunction. Question 19. A client has been successfully weaned from mechanical ventilation. Which assessment finding indicates successful extubation? A. Oxygen saturation of 96% on room air with no respiratory distress. B. Respiratory rate of 38 breaths/min. C. Severe accessory muscle use. D. Cyanosis around the lips. Correct answer, A. Oxygen saturation of 96% on room air with no respiratory distress. Rationale: adequate oxygenation and the absence of respiratory distress indicate successful extubation. Question 20. Which client should the nurse assess first? A. A ventilated client with a high-pressure alarm who is coughing. B. A ventilated client whose oxygen saturation suddenly drops from 97% to 80%. C. A ventilated client requesting repositioning. D. A ventilated client with a heart rate of 92 beats/min. Correct answer, B. A ventilated client whose oxygen saturation suddenly drops from 97% to 80%. Rationale: a sudden drop in oxygen saturation may indicate airway obstruction, accidental extubation, or ventilator malfunction and requires immediate assessment and intervention. Question 21. A client on mechanical ventilation has a high-pressure alarm sounding continuously. Which action should the nurse perform first? A. Increase the tidal volume. B. Assess the client for airway obstruction. C. Turn off the ventilator alarm. D. Decrease the oxygen concentration. Correct answer, B. Assess the client for airway obstruction. Rationale: a high-pressure alarm often indicates airway obstruction from secretions, coughing, biting the ET tube, or bronchospasm. Always assess the client first. Question 22. Which finding suggests a client is experiencing ventilator-associated pneumonia, VAP? A. Clear lung sounds. B. Fever, purulent secretions, and new infiltrates on chest X-ray. C. Oxygen saturation of 99%. D. Heart rate of 76 beats/min. Correct answer, B. Fever, purulent secretions, and new infiltrates on chest X-ray. Rationale: these are classic signs of VAP in mechanically ventilated clients. Question 23. A nurse is caring for a client receiving mechanical ventilation. Which intervention helps reduce the risk of aspiration? A. Position the client flat. B. Elevate the head of the bed to 30 to 45 degrees. C. Encourage large oral meals. D. Limit oral care. Correct answer, B. Elevate the head of the bed to 30 to 45 degrees. Rationale: head of bed elevation decreases the risk of aspiration and ventilator-associated pneumonia. Question 24. A client becomes agitated while on mechanical ventilation. What should the nurse assess first? A. Whether the client needs family visitation. B. Oxygenation and ventilator function. C. Whether the client is hungry. D. Whether it's time for physical therapy. Correct answer, B. Oxygenation and ventilator function. Rationale: agitation may be an early sign of hypoxia or ventilator malfunction. Question 25. A client's ventilator alarm indicates low exhaled tidal volume. What is the most likely cause? A. Air leak around the endotracheal tube cuff. B. Thick secretions. C. Bronchospasm. D. Pulmonary edema. Correct answer, A. Air leak around the endotracheal tube cuff. Rationale: a cuff leak or disconnected tubing commonly causes a low exhaled tidal volume alarm. Question 26. Which nursing action is appropriate during endotracheal suctioning? A. Suction for 30 seconds. B. Use sterile technique. C. Instill saline before every suction pass. D. Apply suction while inserting the catheter. Correct answer, B. Use sterile technique. Rationale: sterile technique reduces the risk of introducing infection into the lower airway. Question 27. A mechanically ventilated client is ready for a spontaneous breathing trial, SBT. Which finding supports this decision? A. FiO₂ requirement of 100%. B. Stable vital signs and improving respiratory status. C. Severe respiratory distress. D. Oxygen saturation of 84%. Correct answer, B. Stable vital signs and improving respiratory status. Rationale: clients should be hemodynamically stable with adequate oxygenation before attempting an SBT. Question 28. Which complication is associated with prolonged mechanical ventilation? A. Ventilator-associated pneumonia. B. Appendicitis. C. Cataracts. D. Gallstones. Correct answer, A. Ventilator-associated pneumonia. Rationale: DAP is one of the most common complications of prolonged mechanical ventilation. Question 29. A client's oxygen saturation suddenly falls to 78%, and the ventilator alarm sounds. After assessing the client, the nurse determines the ventilator has malfunctioned. What is the priority action? A. Wait for the respiratory therapist. B. Disconnect the ventilator and manually ventilate the client using a bag valve mask with oxygen. C. Silence the alarm. D. Document the event. Correct answer, B. Disconnect the ventilator and manually ventilate the client using a bag valve mask with oxygen. Rationale: if the ventilator fails, immediately provide manual ventilation to maintain oxygenation while assistance is obtained. Question 30. A nurse is caring for 4 mechanically ventilated clients. Which client should the nurse assess first? A. A client with an oxygen saturation of 80% and absent breath sounds on the left. B. A client requesting suctioning. C. A client with a heart rate of 90 beats/min. D. A client scheduled for oral care. Correct answer, A. A client with an oxygen saturation of 80% and absent breath sounds on the left. Rationale: severe hypoxemia with absent breath sounds may indicate a life-threatening complication such as a pneumothorax or tube displacement. This client requires immediate assessment and intervention. Comment your score out of 30 below. If this video helped you, don't forget to like, subscribe, and share it with a fellow nursing student. I'll see you in the next NCLEX practice session.